Sir, please explain the varicose veins pathology and what can be done as a training protocol.
Varicose veins, right? And you want to understand the pathology. Okay. Varicose veins itself is a pathology, right? Now, to understand where exactly it exists, we have to understand the anatomy. Right? So we have popliteal fossa at this point, right? So this popliteal fossa is comprised of two muscles. Basically, one is coming from ischial tuberosity, right? This is called rectus femoris. Then semi-membranosus, and beside that we have semi-tendinosus, right? So this semi-membranosus and this rectus femoris makes a nice triangle, and this is called popliteal fossa. From the distal part, we have muscles called gastrocnemius, which is this is lateral head and this is medial head, right? And then we have soleus here at this point. So why I have stressed onto the popliteal fossa? Because from this region we have vein coming. That vein is popliteal vein, right? And this popliteal vein has many branches. This collects the blood from your gastrocnemius. This collects from anterior tibialis. So this is called popliteal vein. Right? And this vein has structure of valve. You know lymphatic physiology. In lymphatic physiology we have studied lymphatic vessels have the valve structure and these veins have the valve structure, not arteries. Okay? Let's zoom on it. So this is your popliteal vein, right? And it has branches. Okay. Now at this point we have valve. So what does this valve do? Valve prevents backflow, right? Now, so suppose this is one valve is present at this point, then one valve is present at this point. Okay, now whenever blood has to go right into the right heart, this contracting muscle will push this deoxygenated blood into this region by opening this valve, right? And immediately this will close. So the backflow won't occur. Okay? From this region, this fluid has to go into the upper region. And from here it has to go into the right heart. Right? Yes or no? At this point we have left heart. Okay. So why these varicose veins looks dark blue? Because they are collecting deoxygenated blood. They are collecting deoxygenated blood. And they are swollen. These veins are swollen. Why? Due to any reason, either immense sprinting or prolonged sitting or prolonged standing can damage this valve. And if this valve is damaged or atrophy is occurred to this valve, the fluid won't go onto the top region here because they are limited with the force. Okay, so from this region fluid directly cannot jump onto the top of the valve, right? Due to which the fluid will accumulate here and this will look dark, right? Now once this fluid is accumulated, the oxygenated blood is accumulated at this point, this will go in swelling, so it will look thick vein at this popliteal fossa or below the popliteal fossa, right? So now it is in swelling. Once your valve damage, it will go in swelling. It will develop inflammation, right? And now it will start trying making more routes or more ways, more branches to send it back to the upper region. And once this is trying something, creating new branches, it will look like spider, right? And that's called varicosities. Right? So what is varicosities? Once this valve is damaged, there is a fluid accumulation at this region. What this fluid is? Deoxygenated blood, right? Now that will create a type of swelling onto these veins, as well as there is increased inflammation, right? And that causes varicose veins. So as you question me what can be done, so you can ask your patient or client to lie down. Okay, I will try to draw something which is at least will give you idea. Ask your patient or client to take his leg up, right, into 70 degree, into 70 degree. Once he takes his legs up, other leg has to be onto the floor. Right? Now, why it should be 70 degree only, not 30 degree or 35 degree? That creates root damage. If your angle is 35 degree or 30 or 40 degree, what will happen? The sciatica nerve, now root will get damaged, right? Sciatica nerve, root will get damaged. So I will explain this sciatica nerve root damage in any upcoming lectures. Okay, let's understand here. what you can do here, once your leg is up at the 70-degree, use a TheraBand, right, and try to hold it. And try to hold it with the TheraBand for 10 seconds. Hold. Right? Do it for 5 to 10 times with each leg. So this will create nice flow to the upper extremity. One more exercise you can add. You have to be in the position whereby you have to just do the ankle plantar flexion and the dorsiflexion for 10 times. 3 sets. Will also activate your calf muscle, right, and soleus muscle. As you know, we are starting up with yoga courses, and those courses will be, trust me, very scientific in terms of injury and yoga asanas. So one asana you can add there is called Janu Naman, knee bending. Knee bending, right? So Janu means knee, Naman means bending, right? You have to be seated upright, and then you have to catch the knee towards the chest and take your leg upward, right? So this kind of yoga asana will be taught to you by yoga experts when they are considering these kind of injuries, right? I hope I have simplified this lecture. Thank you very much.